Hi, everybody. I want to welcome you to Spectrum Straight Talk, to another episode. And I'm Jodi Carlton. I'm an autism spectrum specialist and relationship coach. And today I have two guests with me, Dr. Robert Jason Grant and my good friend, Danyale Weems, who is both of these guys are play therapists. And Dr. Grant is the creator of AutPlay. So I'm going to have him tell you a little bit about that. So thank you guys, both of you, for being with me here today. We're going to talk a little bit about the coronavirus, and we want to be supportive to all of you watching, to our autism families and people out there, to see how we can support you through this pandemic. So guys, thank you so much for being here today. Dr. Grant, I'd like to start with you. So could you tell us a little bit more about, for those who are watching, and for me too, I'm an adult. I work more with teens and adults. And Danyale and I've had this conversation. I'm so glad that there's those of you who work with the kids, because I'm more of the teen and the adult therapist and coach. Tell us more about AutPlay, if you don't mind.
Sure. Thanks, Jodi. It was developed several years ago, actually, out of my own personal need, because I was a play therapist in private practice and started getting referrals for kids with autism and just didn't feel very equipped to work with them. So I'm going to make a very long story really short and just say, through a series of trainings and resources, I was able to put together this protocol for, at the time, really just play therapists to use for kids who would come in to see them who had autism, because the issues were different, the family system more unique than what we would see with neurotypical kids in play therapy. So it's really a play and behavioral based approach to working with kids and families. It's technically an integrated family play therapy approach, because we do work a lot with parents and other family members, as well as the quote unquote identified child. And there's a lot of emphasis on skill development, relationship development, and using play therapy interventions as a modality to help with that skill development.
That's fantastic. And I know, Danyale, you have shared with me periodically over time, you and I haven't had lunch in a while. We need to do that again. You've told me a lot about some of this and shared with me what you do and how this works. I know both of you are supervisors in the play therapy world. And so I know this is such an important modality, that the play that you do, the way you interact with kids by playing with them. A question I would have and I want either one of you to field this question and tell me how this applies to the work that you do. I was talking to Dr. Temple Grandin yesterday. I scored an interview with her, and she was talking about how a lot of folks with autism are visual thinkers, and it's so different than talking like the traditional talk therapy. How does that come about in the work that you guys do with your families, the visual thinking?
Well, I think, at least in my work, especially in play therapy, we talk about that the toys are the words for the children, and then the play is the language. And so I think children who are on the spectrum, they have the opportunity to learn that the toys can communicate differently for them, that a car is not just a car. And as a play therapist, and then as working with children on the spectrum, a lot of what we do is start to help them to learn what pretend means. Many of my kids have, and I know Dr. Grant's as well, have like certain things that they really, I want to say, fixate on, so to speak. So I've got a little boy who his thing is all about storms and natural disasters. And what I have been able to learn, and what he has been able to help communicate to his family, is when he starts talking more and more about natural disasters, that's when his anxiety is getting higher. So he's able to use, we've been able to connect it in a metaphorically way. And I think that's also that part of play therapy that happens, is that we have a lot of metaphor that takes place, that we as the clinicians are able to kind of see shape and form through their play. And then I know for the children I work with on the spectrum, we do a lot of the drawing of faces, or we make faces together. So there's that visual component that comes out in that, because I use a lot of expressive arts with them. And then I use a lot of body movement with them. And so that helps, I think, to connect things a little bit more than just saying, this is this. Then we can start to show what this is in that visual world.
Yeah. And so, well, did you want to add anything to that, Dr. Grant?
I would just add to that real quickly. I think it reminded me of so many kids on the spectrum I work with who have a fear of storms. Maybe it's being here in the Ozarks with all the tornadoes, but same kind of idea. A common play activity would be an expressive arts activity where we would draw a tornado, the child would, and kind of to help them express their worries and fears. And then I've added this visual component to that where we actually rank it on a 1 to 5 scale of, what's happening and where's your anxiety? Okay, did you hear about a tornado warning? Is that a 1 or a 2? Now did you hear about, a watch? And then we climb all the way up to a warning, or it's in your town and you're going to the basement. And what can you do at each one of those steps or phases of your anxieties increasing to help you calm down and relax? Or what's a thought you need to remember? And then that visual is present, and they can take that home actually. And parents can continue to go over that with them. They can pull it out when actually the next tornado is coming into town. So it's visual, it's skill development, but it's also intrinsic. It gets them talking about their feelings and thinking about them, acknowledging them in a way that's safe for them.
That's so interesting that you mentioned the scale, the 1 or 2. And so that kind of takes me into part of what I want to talk about today, about how we can, some tools that we can give families and folks at home, because really what we're dealing with here is a different kind of storm, and this is a disaster, a natural disaster that's happening. And I know there's so much fear that's going to be cropping up for these kids that may not be able to really understand what's happening, but they see that their schools are closing and their churches are closing and their OT clinics and the places where they go and the providers that they see, their counselors that they go to, their routines are totally disrupted. They see their parents, they can kind of sense that stress that their parents are experiencing. And I want to just kind of mention that scale, that's something that I use myself with couples in their relationships. And I teach them, I call it the 2 or 10 strategy, where, when there's some kind of stressor, I teach them to identify, is this a 2 on my stress scale, my stressometer, or is this a 10? And that's a way for them to communicate to each other. Is this a big stress that we need to really address further, or is this something that I think we can pass on this? So let's kind of move into a conversation about how specifically we can help these families. But first, I'd like to hear from both of you. How is this affecting you personally? How is this affecting you in your families, but also professionally in your professional lives?
Well, I can go first. I feel like I'm in the middle of chaos every day, to be quite honest, and try my best to manage that within myself first, so then I can help manage it, with clients. Being in private practice, I have and continue, it's not settled. And I think the unsettled piece is a big piece for anxiety. I get daily, hourly, I feel like, a call from a client, an email, somebody wants to go to telehealth, or somebody wants to just wait indefinitely. And what does that mean? And managing a clinic, then there's the whole administrative piece of therapists coming and saying, all my clients canceled this week, just trying to think ahead about paying my rent. And it's just craziness right now. I think we're all just in this time of everything is sort of pulled out from underneath us, and we don't have a good routine, we don't have structure, and we don't have a predictability in place, and we don't have an end in sight necessarily for when things are going to look like that.
Right, definitely. How about you, Danyale?
So I think so far, my practice has been a little less affected currently. Just in our area, we only recently just got confirmed positive cases. So I'm preparing my clients and I'm preparing my parents for us to move towards telehealth. And it's offered at this time. I think on the personal level, I have two children of my own. And so with their schools being closed, my youngest has anxiety disorder, and he is much more clingier than he usually is at this point. And he's coming to work with me, and he's requiring just to have more of that physical presence comfort that I think many of our children do require. And it is definitely hard because their routine has been completely changed, and his ability to come to work with me is great, but then that's a whole different routine for him because I'm in session most of the time. So I think here we're sanitizing and we're washing hands. We have our parents waiting in cars. So I have had some clients have had to cancel because they're not, just that separation anxiety of I want my mom in the lobby, not in her car. So we're definitely seeing some impact, and I think I look for us to see a much more impact over the next week or so. And I'm with Dr. Grant. I'm definitely worried about, paying my staff, continuing to pay the rent, continuing to provide for our families and our parents and our kids that need these services and need these resources. And at the same time, they're having to move outside that comfort zone into working on that telehealth aspect of it.
Right. Yeah, it's been such a transition for all of us. I'm fortunate that I transitioned over to virtual about a year and a half ago. So I already have that infrastructure in place, and my clients are virtual already. But interestingly, I've already started to see cancellations on my calendar, even though they're virtual. I have clients on the West Coast and in California, and it's even hard for them to meet with me because their families are at home, their kids are at home, and it's just everything's in disruption. And I had a client text me this morning. He missed his appointment with me, and he said it's just chaos here. It's just chaos, and they're in LA. So it's just, even the telehealth option is there, but everybody's just so disrupted. But I want to encourage our viewers to remember that we are still here for them, and that right now I think that we're in such a transition to home stage in this initial crisis aspect of this. But like you said, Dr. Grant, we don't know when this is going to be over, and I think this is going to be kind of a longer term thing. And as we kind of settle into place, I want to encourage everybody to know that we're still here. We're still here to support them, and I want them to reach out to us, because mental health is a huge thing that this is going to really challenge the folks with anxiety, and it's just going to be a struggle for so many people to have this type of demand on them, being stuck at home. And I've been happy here. We're in Georgia, by the way. Danyale and I are. I don't know, where are you, Dr. Grant?
Missouri.
We've had some really good weather here the last couple of days, and I've seen so many people out walking, keeping their distance, but walking and getting fresh air. Of course, the pollen just hit here too, so it's like, ugh. But so anyway, let's move on. What, Danyale, did you have something? It looked like you were about to.
Oh, well, what I was going to say is, I think the other fortunate thing is we have had great weather, but I'm in a place where I have an outdoor space. So my families right now can bring the siblings and they can play outdoors, and I have outdoor supplies for them to get out and spend that quality time while the sibling may be in therapy session with me. And I think that's been another positive thing amidst all this chaos, is that they are still able to get their needs met because we have the ability, the space to do so.
That's super helpful to your families for sure. So let's kind of move on to, what kind of changes or what kind of response do you expect to see from your clients, from the kids on the spectrum specifically, and even not, because the folks who are going to be watching this are going to have children on the spectrum, spouses on the spectrum, and then siblings who are not on the spectrum. So what sort of behavioral responses are you expecting to see?
Yeah, I mean, I think the disruption of the routine is going to be really hard. That could be true for any child, but I think it's especially true for kids on the spectrum. They're used to their routine, what they expect to happen, when they expect it to happen. And for a lot of my clients, that has just been taken away and pretty quickly. And I think parents are going to be able to get a new routine in place. It will happen, but right now it's taken a little bit of time. And so I'm seeing just more dysregulation, some anxiety, some stress due to why aren't we doing this now? Why can't we go there? Why isn't this happening at this time? And parents struggling to figure out, how do I do this with my child at home all day and have a structure, a routine for them that's regulating. That's one of the things we know about that. You mentioned visuals, a visual schedule of how your day is going to flow, telling the child ahead of time where they're transitioning to, what's happening. That's a regulation activity. It doesn't just help get those things done, it helps get them done smoothly. So there's not the child getting upset. So I'm already seeing that, and that's coming into my office and in our conversations. So I'll let Danyale share. I'll stop there.
I think I'm going to agree. I mean, I have, even just in the practice right now, I've had to change some routines for the children. And, I've added in, let's wash our hands before we leave. I've taken away the transitional object that they used to get. And that causes that anxiety to go up as well, because that's what helps them to transition.
Can you tell us what you mean by that, the transitional object?
So when children leave my space, they get to choose either what I call a happy stone, and it's just like a little bead, a little stone that you would put in like a flower vase, or they get to choose what I call a warm fuzzy, which is just a pom-pom. And the children really seem to like those, and they collect them, and it really helps them transition both out of the playroom and then out of the building. So that's been something I've had to take away, just, to prevent the transference of germs. And I can spray them and wash them, but that's a lot extra that I'll have to do in between each client. So I've just kind of pulled them out, and I've had to pull the toys out of the lobby, which I think that has been another thing for them. When they're used to coming in, they get to sit and play or read a book, and now they're not getting to do that. So I'm seeing, just in my neurotypical children, I see that anxiety. They're worried. So I think I sneezed the other day, and one of the kids immediately had that hyper aware of, and it's okay, it's allergies. But I think I'm seeing that. I've got in my children who are on the spectrum or have some other medical challenges, I see the excessive worry, talking about I want the coronavirus to go away, and they definitely are worried that their elders, because many live with grandparents, so they're worried about their elders. They're definitely, it's just that ramped up anxiety piece. And so what tends to happen, or what I've been seeing some as well that my parents are talking about, is we're seeing increased physical aggression, which does tend to, come with anxiety. When I don't know how to express it, then I express it through my behavior. And so we'll see the increase in the physical aggression, the increased avoidance, the increased guardedness. And so it's definitely dysregulating at this point, I think, for everyone.
Yeah. So a question I'd have for you guys, you know, one of the ways that we can control our anxiety in general is to inform ourselves and to be so that we can be prepared and we know how to keep ourselves safe, you know, how to keep our grandparents safe from our germs. But something that parents have asked me in the past is how much do I share with my child about what's going on in the world? And I know a lot depends on the child and their ability to handle that information. I know yesterday when I was talking with Dr. Grandin, she was just doing as much research as she could possibly do about the treatments out there. She just wanted all that information. And she was really recommending that older students and teens get online and do their own research. And what would your recommendations be to parents about how much they allow their kids to see the news or to how much do you talk to them about what's going on? How do you make, do you make this an education lesson? You know, what are your thoughts on that?
Well, I would say yes. You can make it an education lesson, especially if now you're doing homeschool activities. I think many schools around the country are closed. You also have it just be conversations. I always encourage parents to talk to their kids about situations like this because it does help children to have information. You don't have to give them every detail and you certainly don't want to go above their developmental understanding. But when kids don't hear, they tend to assume the worst.
Mm-hmm.
And so they need some information. For younger kids, circulating all over social media are a lot of social stories about the coronavirus. That's a great way to start a conversation with a younger child, or maybe even a teen who's more severely impaired in terms of their autism. There's also some good YouTube videos out there now about it if you want it in video format, which you could go through with your child. Of course, if you're going to use some material, caution to parents, go through it first yourself. Read it first, watch it first, so you know what it says and what it shows, and then sit down with your child and go through it and have a conversation. And try to be matter of fact. We don't want a parent crying conversation. So, try to get in that parent mode where you have your stuff in check for that time that you're going to have that conversation. And it may not be a one-time conversation. This may be a revisit, multiple times.
Right. Danyale, you have any thoughts to add to that?
I mean, I agree with Dr. Grant. I think our children are living this, and so it's really important that we help them. We provide that education and that we give them the facts that are out there. I think it's our responsibility, both as a parent and as a clinician, to do so, especially, definitely at an age-appropriate developmental level. I've been using some of the material that he's mentioned that's out there. I encourage my parents to use it, and then I encourage them to do repetition of it because as we know with children, especially on the spectrum, that repetition is so important for them to learn the skills and to retain that information. But I think even just with children not on the spectrum, I know my own child who's still living at home. He's in high school. He's 18. He's been doing his own research, and this is definitely causing him a lot of anxiety in terms of he's about to go. He's in the National Guard and supposed to be going to college, but we don't know when graduation is at this point. So we have a lot of, and I think that's where some of the unsureness definitely is coming in with some of the kids I'm working with, is because our schools were closed until the 31st. And now we've got notice today that they're closed till the 13th. So it's just rapidly, we go a week and all of a sudden we're going to add more time to school closure. So I think it's really important that we're continuing to give them the information they need. It helps to settle that monkey brain, so to speak.
Right. And, I was watching the news a couple of days ago and they were interviewing a psychiatrist and she mentioned how anxiety is actually a very not an anxiety disorder, but anxiety is a natural phenomenon that alerts us to danger and helps us to recognize that there is danger so that we can deal with it. And so I think, like you said, Danyale, our kids, we're all living this right now. And so the generations, even our generation has never really lived in a war, a true war or a crisis like this. And so some of our instincts maybe to shelter them and to not let them be exposed to some of this that's going on. But the truth is that we are living in it, and they need to learn those skills to deal with fear and change and disappointment. And I agree with both of you, and I've always advised parents too when I've worked with them that that's important. So, well, do either one of you have anything else to add? We have about 5 minutes or so left. What other thoughts do you have about this?
I think Dr. Grant mentioned earlier when he was talking about parents sharing information, we definitely don't need, a parent in tears and crying when they're sharing this information. So I think it's really important as the adult that we're modeling how to manage the anxiety and that we're modeling how to regulate that anxiety. And I think that's where it really does come into play in terms of sharing information with our kids, but also building in those regulation activities throughout that routine on that visual chart that will really help kids to learn the skills when they get older and as they're growing up on how to manage that uncertainty and that feeling of chaos that's going on in their bodies.
Yeah, I agree. And I would add that I really like what you said, Jodi, at the beginning of this, that I want everybody watching to remember, and I think this is pretty true for most mental health professionals across the country, is that we are there. Even worst case scenario, we're there via phone. We can do phone sessions. And so, if nothing else, we can meet with people that way and talk with them. And I've done phone sessions in the past, and they can be very productive. So we've got options to continue to see people and help people. So utilize, those therapists in your local community if you need them during this time. And not that I'm plugging anybody in specifically here, but I did just see on the Autism Society of America page, they have a big page now that's just full of resources for families who are affected by autism regarding the coronavirus. So, look for your resources too. There's a lot of good ones being shared out there that can give parents and families some good information.
Oh yeah, definitely. And yeah, I don't think that it's really a matter of who. Autism Society, Autism Research Institute, whoever's out there that's able to support our families, that's what it's about right now.
Yeah.
And absolutely, the majority of my coaching calls are calls. I give my clients the option to do video, and I've found that most of them are more comfortable just being on the phone. So it absolutely works. And as a matter of fact, when I work with folks who are on the spectrum, they have found that it's less of a distraction for them to actually have, because there's no eye contact, there's no body language, there's not that extra layer of having to deal with that processing. They can just listen to my voice and process what we're talking about. So, and then a lot of the work that I do, you guys work with the kids and the parents, but a lot of what I do is I work with those adults who have those kids also, but so many of them, because we know of this genetic component, are married to someone on the spectrum too. So yeah, those of you who are watching, we've got people out here to help you. So reach out to us. We're out here. We're figuring out how to implement all this change too, to support you, but we're out here to help you. So don't try to do this alone. Everybody's adjusting right now, but know that there are resources out here. And that's why I wanted to put together this video cast, and I'm trying to pull in as many professionals as I can to just have these conversations so that we can help the folks out there. So again, I thank you both for coming. Is there anything else that either of you want to add?
Not me, just thanks, Jodi. This is great. And hopefully it gives some people some info and helps them out during this crazy time.
I hope so. Well,
I agree with Dr. Grant. Thanks very much.
and thank you for setting things up for me, Danyale. All right. Well, I appreciate it, and hope to talk to both of you soon. And you guys both stay healthy and stay well. I hope your families stay well.
You too, Jodi.
Hey folks, if you're still watching, I just wanted to let you know that if you need some support, that I've opened up my calendar for you guys. Normally I have a 4 or 8 week type coaching program for adults and couples in autism spectrum relationships, but I've suspended all those programs right now, opened up my calendar for single coaching calls for those of you who just need to reach out and have someone to talk to. I get it. I get where you are. So I've got some 30-minute and 1 hour coaching calls available to you. I'm going to drop the link here in this video so that you can schedule an appointment with me. I'm set up to talk to you on the phone or on video nationwide here in the U.S. So if you need some help, if you need some support, just reach out and we'll chat soon. Hope you guys are all staying well.